Hello, I'm Shivan Sarna. It is so great to have you here. I am absolutely delighted to have Dr. Allison Siebecker with us today, continuing her teaching on the SIBO treatment series. So many of you came to the first treatment. There were, thousands. So thank you very much. Glad that you're here as well. And we do have some goodies for you. If you stay to the end, we'd like to give an incentive to stay until the end. We will be finishing right on time. That this is a 2-hour session. If you have to leave, we totally understand, but we hope you do stay until the end. Afterwards, I will be going into another Zoom room. So I'll put it in the links at the end, and we can I will go and hang out with you for about 15 minutes in case you had any logistical questions or whatever, or, we just want to brainstorm together. But in the meanwhile, I wanted to start officially. Can you just pop on, Dr. Siebecker, in case someone doesn't have that view on, and say hi?
Oh, you mean I have to speak for them to see me?
Yeah, it depends on how their settings are. Yes.
Hi, here I am. Hello.
Hello. Hello.
So happy to be here.
Everyone's here for you, my dear Dr. Siebecker, world renowned.
And you as well. And I'm here for them. I love it. For all of you.
SIBO specialist. Okay. So thank you for letting me know where you're from. We love that. People from around the world have been watching this training, and we have so much to get to. But one thing I wanted to just quickly ask you is, did you realize that there are so many different types of SIBO, 4 of them, and that each different one has a specific and different treatment to it? Now, if you're like, oh yeah, Shivan, I read your book, I've done your summits, I know all this. Okay, bear with us. You're going to be glad that you're here, and you're going to want to stay for the lesson, because Dr. Siebecker is going to explain which treatment works for which gas. And yes, they do work, and she's validated it, and she's going to explain that too. So if you also have IMO or methane overgrowth or hydrogen sulfide, you have a problem with hydrogen. So, and by the way, if you're brand new and you're like, I don't want to blow up a balloon with hydrogen, I don't know what's going on, just hang out with us. We'll get you there. No problem. So in this webinar, a training, whatever you want to call it, this get together, we are going to help you solve the problem of being able to figure out exactly what to do next in terms of your treatment, depending on what kind of gas you have. And if you were here in the first session, Dr. Siebecker went over the SIBO Recovery Roadmap, or the algorithm, or the flow chart, whatever you want to call it. And she's going to show you where this fits into all of that. So let me do this. And let me do this. Hold on. I'm gonna nail this with my computer, which, if you weren't here before, it was very stressful for me because it didn't work for a second. And I got it in the nick of time. So thank you very, very much for your patience. Okay, here it comes. Here comes my little slides. Can you see that? Yes, you can.
Yep.
Can you see anything else, like any other drama on my computer screen, or just the kitty and the butterfly?
Just like it looks like what we're supposed to be seeing. Yeah.
Okay, good. So welcome to the free SIBO patient training with Dr. Allison Siebecker and me, your host, Shivan Sarna. So not that I think anybody needs to hear this, but we do have a policy in our Facebook group and in these events to be nice or be gone. And the kitty cat made me happy. And the butterfly symbolizes our transformation together. So also, the hardest part of the webinar is, would you please challenge yourself to turn off your phone. Goodbye. I just told my sisters I can't text now. That's a big deal for me. Here comes my phone. I'm turning it off. I don't know if you can see me. Doesn't matter. Okay, my phone is now off. The world will not end, even though I'm tempted to think that. So please do turn off your phone, put the sign on the door, whatever you need to do. This is for you. This is a session of hope and learning, and you richly deserve to hear this and to acquire this knowledge so you can take that knowledge and turn it into thinking. So the chat box is for links. And when I ask you a question, and I hope you'll respond, put it in there. If you have a technical disaster, and Clarissa, our behind the scenes team member, can hopefully help you with that. That's what the chat is for. The Q&A is for questions. So please do refrain from chatting about this or that during the session. Last time, people found it very, very distracting, depending on the settings that they had. And we really just want to keep this focused on this content. May I just say that if you were in a medical school, this is the level of information that you would be getting, but it's translated into like real people's communication and terms. So it's extremely valuable. And be sure to sign up for our third training, which is the most overlooked part of SIBO treatments. We didn't mean to be mysterious about that. It is indeed prokinetics and how to avoid relapse. So
All about relapse.
All about relapse and relapse prevention. So that is what's happening later in the week. And we'll give you, if you've probably already been bombarded with details on that. So we'll put some links up at the end. Okay, so I stopped sharing. Way to go, Shivani. Very good. And now what I want to do is just quickly tell you a little bit about my my backstory and how I happened to end up here with you all. And that is that, I had been a TV host for 20 years. I still am on TV about, 10 times a month on one of the largest television stations in the country of the United States. It's kind of crazy, but it's true. And I was very sick, very, very, very sick. And it happens to be a mold infested building, which not everyone at the network thinks or believes, but that's because they didn't get sick from it. And it's interesting, but I know it is infested with mold because I have friends that were in the executive circle that confirmed it for me because I thought I was going crazy. And so what happened, but that's just an aside. When I was so sick, I went to where else did you go, right? Dr. Google, right? I went to Dr. Google and I tried to find answers there. I finally was able to get an appointment with Dr. Allison Siebecker. We have now become friends and colleagues because we have a mission in common of sharing this information with the world. So we've had millions of views since we started together, which is so exciting, but we need 1 billion. So please spread the word about our work. We really appreciate it. And, I did end up getting that important negative SIBO breath test with my incredible doctor, Dr. Michael Schulman. And I tell the story in my book, Healing SIBO, about that. And I got the negative, but then I got methane. And when I finally found out, I didn't really realize that there were different types of SIBO and that you needed to manage that SIBO with different treatments. So while I had been feeding my doctor information from the things I was printing out on PubMed, and I was just scrapping it all together and hoping for the best, and portals, he didn't use a portal or anything. I was trying to get through the nurse. It was a nightmare. Anyway, we realized that mine had switched, as they often do. So I was able to change my treatment based on the different types. And that's what Dr. Siebecker is going to be teaching today. It's so unusual to be able to be so active in your recovery for a condition. I can think of diabetes. You treat your diet and exercise. That's certainly important. But how exciting that if we did have to have a condition, that it can be done with things that don't always require a script, although we always suggest that you do work with your practitioners. Of course, we are very happy about that. So Dr. Siebecker's algorithm was a huge, huge revelation for me and a relief for me. And I know it's going to be that way for you too. And Dr. Siebecker and I have been working on these projects. Hang on, I want to share my screen one more time because it's going to be really fun. I say that now. She and I have been working on these projects. Hang on. Well, I'll show it to you later because I can't find it right now. I want to introduce you, Dr. Siebecker, and get to it. So Dr. Allison Siebecker is a world-renowned, award-winning from her peers Lifetime Achievement Award naturopathic physician. She is also an IBS patient and SIBO patient. Clarify that. And she's here to share with you her mission, her knowledge, and her compassion. And take it away, Allison. Tell us your story of how you got into this and how your life has been impacted by it.
Well, we have the same unfortunate background story, which is that we both got IBS, later identified as SIBO, at 5 years old. So we both have that in common, and we've had it our whole lives. Of course, we're so much better now, extremely well managed. And Yeah, so I had constipation type, but I had the type that had really bad abdominal pain. Like it kept me up awake at night a lot throughout most of my life. It was so awful. And I just didn't get any help. So I'm in the same boat as so many people listening. I wasn't able to find help for so long. I went, when I went to medical school, I went to all of my own phenomenal teachers, but they just didn't have this information. That's the issue. And as soon as I found information and applied it to myself, and I got relief. The first thing that I tried was actually one of the diets that we use for SIBO, and within 24 hours, my abdominal pain was gone. Actually, it's just sort of miraculous, incredibly miraculous. And so that is what really sparked a fire in me. And after that, I just really wanted to get that information to as many people as I could. It's really just that I just didn't want anyone else to have to suffer the way that I had suffered when I knew that there was help. When I wanted to get that help to people, I didn't want people to go through what I was going through. So that's what I'm going to do today. Obviously, knowledge is power, information is power. And you have to know what treatments to do. You have to know what tests to do, what the steps are, what the types of SIBO are, etc. And that's what I'm going to do today, is talk to you about that.
So I wanted to also, just for a second, as we just take a breath, we're doing well on timing, just to take a breath and do an intention with me, which is so woo-woo, and I am totally woo. So, and that is, imagine your life on the other side of SIBO. Like for me, I'll just tell you, for me, I will look forward to continuing to feel better and feel well and very well managed indeed. But there were times when I could barely speak, literally, which is very scary for a talker, that's my job. There were times when I had to go to a big box store and grab some clothes to wear because none of my clothes fit me. So what is it about you? What do you have? Just put down a dream. Is it to button your pants? Is it to be out of pain? That's what the chat box is for right now. Just type in a one sentence intention of, this is going to be for me on the other side of SIBO. Do it. Let's do that. Just for a sec. Yes, I'm being quiet while that happens. Thank you. Bring it on in. Come on. Energy, wear jeans, dinner with friends, no diarrhea, have energy. Yeah, energy's a lot. No more bloat, stop the bloat, poop normally. Oh yeah, baby, bring it on. Oh, I love this. Stop constipation. Be free, your hair, brain fog. Oh yes, we are with you 1,000 bazillion %. No nausea, have energy to function. Yeah, we are with you 1,000%. Okay, thank you. Thank you for doing that. I love that. Okay, so remember, the major thing we're going to be teaching you today is the four different gases and their treatments. So you can dive deep for yourself, but also share information with your practitioners. How many of us have trained our doctors? You don't even have to put that in the chat. Don't do it, because it'll break the chat. It'll break the chat unless you're lucky enough to study, or I say study because I've learned so much from Dr. Siebecker and the other few specialists in SIBO, although we're working on changing that because Dr. Siebecker has been training people around the world for professionals, but also a program right now as well. So you're going to learn how to pick which treatment is right for you. We're going to talk about the power of herbs as treatment, as well as, yes, pharmaceuticals, which I know is a hot topic. And remember, I was very, very scared of antibiotics. And I was like, well, hell no, because no, I'm just not going to do it. My microbiome's already messed up. Dr. Siebecker will explain to you why something might be different than what you might know about, or think you know, I should say. And you're also going to learn, at my request, about the term IMO, which could really trip you up. And I've seen this happen already in the Facebook group with the 22,000 people. And I don't want you to do that. I don't want you to have SIBO panic. I don't want you to get tripped up by a terminology issue. So hang in there with me. Now, and by the way, hello and welcome to all of the people in our SIBO Recovery Roadmap course. I recognize your names. Thank you so much. If you're not in that course, don't worry about it. We have a course on patient care for yourself and how to go through this algorithm and how to deal with the treatments and the whole thing. It's literally the roadmap to recovery. And I'll be telling you a little bit about that at the end. This is not an infomercial for the course. We've been to webinars before where it was like, oh, we had you here for this, but we're really doing that. No, you will hear about it, but briefly, and it is a great answer for so many people. So that's exciting for us. We're really looking forward to that. And if you stay till the end, you will be getting some resources. So I'm going to let you know about those. But in the meanwhile, Dr. Siebecker, I would love to hand things over to you.
Okay, excellent. I'm going to share my screen. Okay, are you seeing that all right, Shivan?
Yes, it's gorgeous. Gorgeous.
Excellent. Okay, so last webinar, I went over this whole SIBO treatment flowchart. We're doing a series of 3. This is webinar 2. Today, I'm focusing on the types of SIBO and IMO and the treatments that work for each type. And I have that circled in the black circle. And webinar 3, let me see if I can do my thing with my laser pointer. Webinar 3 will be on this whole area, all about relapse, underlying causes, prokinetics, etc. Okay. One of the key things you need to know before beginning your treatment, your SIBO treatment, is your SIBO IMO type. There are 3 gases the overgrown microbes make: hydrogen, methane, hydrogen sulfide, and we have a 4th category for when 2 or more gases are positive, and we call that mixed type or sometimes combination type. Traditionally, mixed SIBO meant hydrogen and methane gas, which is why I have it in bold here. But what's new is that now we know that hydrogen sulfide, listed in teal here, can occur with hydrogen and methane gas. We used to think it couldn't, but it can. So the mixed type has gotten more combinations of gases added to it. The gases correlate with bowel movement symptoms. So hydrogen correlates with diarrhea, methane with constipation. Actually, methane we know causes constipation. Hydrogen sulfide can correlate with diarrhea or constipation clinically. Hydrogen and methane together usually have a mixture of diarrhea and constipation, some aspects of each. That's the traditional IBS alternating and also mixed type. And then if hydrogen sulfide is there with methane or all 3 gases, we could have really any bowel movement pattern. The rest of the SIBO symptoms like bloating, abdominal pain, food sensitivities can be present with any gas. Here we're just talking about the bowel movement symptoms. Now the gas and the bowel movement type don't always correlate, as I'm showing here, just mostly. And testing is needed to know which gas type you have because the symptoms don't always correlate. And for example, hydrogen sulfide could be present with any bowel movement symptom pattern. Also, we need testing to know how high the gas is because this helps guide which treatment type we're going to do. And it also predicts the number of treatment rounds that we'll need. And I touched on that last time. So the SIBO test that I like to use would be a 3-hour lactulose breath test, maybe fructose as well. Shivan and I have some interesting information from a colleague. Watch your inbox for more on that. But for now, a 3-hour lactulose breath test. And lactulose is prescription in the United States, but patients and prescribers, practitioners without prescribing rights can actually order their own breath tests through direct labs. And I think we have a link we can post to that. Shivan, do we have a link for direct labs?
Yes, we will put it in the chat.
So you can actually order your own breath test, lactulose. Now, the other test I also very much like and recommend is the new Trio Smart breath test. It's been out for about a year. This one tests for hydrogen sulfide. Our original tests, all the tests test for hydrogen and methane. And the technology had to be invented to sample for hydrogen sulfide, and that became available about a year ago. That is practitioner ordering only, though, Trio Smart breath tests. So treatment. treatment is based on gas type. This is why gas type is so important to know and why you need to test to find it out. Each gas is made by different microbes. And so really, the treatment is based on the microbes. The gas are just representative of those microbes. And so that's what our treatments are focusing on. And that's why it's so important to know your type. And we know that different antibiotics are used for different conditions, depending upon what bacteria or microbe is present. I think most of us are kind of familiar with that concept. So hydrogen gas is made by E. coli, Klebsiella, and a little bit less so, Aeromonas bacteria. Methane gas is made by M. smithii, which is not technically a bacteria. That's in the category of archaea. And for hydrogen sulfide, we're still waiting for some wonderful research to come out. We do know from current animal research that F. varium causes hydrogen sulfide SIBO, at least in an animal model. Now, Dr. Mark Pimentel is the one who has researched this, and we're expecting his results in the future, and we look forward to that. So I've been saying SIBO and IMO often, and as Shivan mentioned, I want to clarify this. So you may be wondering what IMO is, IMO. So the traditional types of SIBO were all called SIBO, and they were just by gas. And sometimes we would use the bowel movement symptoms. So hydrogen SIBO, methane SIBO, hydrogen sulfide SIBO, and mixed SIBO. But then there was a name change that was proposed for methane SIBO to be intestinal methanogen overgrowth, or IMO for short, said as IMO. So why this name change? The primary reason is a nomenclature issue. Methanogens, as I just mentioned, are archaea. They're not bacteria. So that means the B in SIBO, 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 for bacteria is incorrect. So that is really one of the primary reasons why for this name change. But also, methanogens can overgrow in the large intestine too, not just the small intestine. And that makes the SI in SIBO for small intestine incorrect at times. And intestinal, just the word intestinal for intestinal methanogen overgrowth, is more accurate. The next reason has to do with the cause. The most common cause of the hydrogen and methane mixed type is food poisoning, which is just astonishing. It's still an astonishing thing that food poisoning is the primary cause of most forms of SIBO. Now, for the methane type, food poisoning can cause this. It's just in much less of a percentage. It's not the main or majority cause like it is for the hydrogen and mixed types. So the cause is a little different here. And last is perception. So many people have heard Dr. Pimentel say, we should think of methane SIBO or IMO as a different disease. And I know that's been very confusing for a lot of people, but what this is really about is it's predominantly about the fact that a different bug, M. smithii, is creating it from the other types, and it has a somewhat different cause. And this very much helps explain why we need a different treatment and why we have a different prognosis, meaning how challenging it's going to be to treat, because these archaea are challenging to treat. And so this is really where this different perception comes from. It's not a bacteria, it's an archaea. It's a little bit more difficult to treat. It's not even caused as much by the same thing. However, hydrogen and methane coexist. They come as one unit, as I've just showed you, one condition, so to speak, very commonly. And like in Shivan's story, they can convert back and forth. A person can have only hydrogen positive, and then they can become methane positive, and vice versa. So I think thinking of them together as, let's just say, SIBO with one name certainly makes sense. So there's a real pro to thinking of IMO or methane SIBO as a different disease, and there's a con, right? There's a pro and a con. The key take home is that methane SIBO and IMO are synonyms. They're the same thing. It's just a new name for methane SIBO. And I want to give you an example of this to prove it's not just me saying this. You don't have to take my word for it. This is a recent example from an article on Parkinson's disease and SIBO from November 2021. And here in this picture, the labels for the picture are blown up here. And you can see it says methane predominant SIBO / IMO. So I think it's a very good idea that they use both terms, because IMO is still such a new term that many readers of this article probably don't even know what it is. So we're going to have to use both terms for quite some time till we get used to the new term. So the confusion that many people are having about IMO, sometimes Shivan has told me some people are getting upset when people like myself or anyone else isn't using the term IMO. And I would first just say, try to give those of us who've been in the field a really long time a little leeway, because it's hard to start saying a new word when out of your mouth immediately comes the old word, because you've been saying that for so long. And just remember, they're synonyms, they're equal in meaning. And there's really good news here, that IMO is not a new disease, it's methane SIBO. And this means we already know how to treat it. We have effective treatments, which I'm going to show you. And I think this is what is confusing so many people, potentially when people, maybe when they hear Dr. Pimentel say it's a different disease, they might think new disease, but it's not. It's just the same old SIBO, methane SIBO that we've always known about. And we know what works from research and years of clinical experience. So the key here is that we're not back to square one, knowing what to do about treating IMO, because it's methane SIBO. So hopefully that takes some of the concern and the anxiety down. So previously, all the gas types were called SIBO, but now when methane is positive, it can be called IMO. And I use both the new and old terminology, and I also sometimes just say methanogen overgrowth. But it's like if somebody said large intestine and colon. Those two things indicate the same organ. We didn't always used to know which microbes were making each gas in SIBO and IMO. Actually, the first one that was published was methane. It was M. smithii. We found that one out first. And then just a couple years ago, the hydrogen bugs were identified. We still don't officially know what the hydrogen sulfide bugs are, and we're waiting for the research to be published on that. And it's very exciting. I can't wait. Now, this means that the treatments that we have and that I'm going to share with you were developed by trial and error, because we didn't always know what the microbes were. When we found what worked, like Dr. Pimentel, he did lots of research on this and he would publish the results. So many of these treatments have been published, but many of the treatments that we know work have not been published. And those of us who are SIBO specialists, we teach them at conferences and webinars, like myself and Dr. Pimentel and others who are specialists. And so that's how we share it. You can't look it up in PubMed. So I've been mentioning Dr. Pimentel a lot, just in case any of you don't know who he is. He's our leading researcher in SIBO, a very nice person and devoted to finding a cure for IBS that is SIBO and IMO. And 60 to 70% of IBS is SIBO and IMO. He works at Cedars-Sinai Medical Center in Los Angeles, and he has been leading our field since the early 2000s. And now he has a phenomenal new research program called the MASS program, still at Cedars, and they have been pumping out the discoveries from that center like every year. They have mind-blowing information. I mean, he's really doing new revolutionary research, and we are all just so grateful. And then here's a picture of me and Dr. Pimentel when I was observing him precepting in his clinic back in 2014. And then Shivan and I, some years later, recorded him for some classes, just showing you about Dr. Pimentel. I refer to him constantly, so now you know who he is. So I'm going to share with you what I use for SIBO and IMO treatment, but I want to explain how I know that the treatments work. I mentioned this during webinar 1 in this series, but Shivan asked me to share these highlights again. So I learned about SIBO in 2009 or 2010, I can't remember, at which point I shifted my focus and my practice entirely to SIBO. And soon after, my colleague, Dr. Sandberg Lewis, and I created the first ever SIBO specialty clinic at the medical university where we both teach. And so this is a picture of Dr. Sandberg-Lewis and myself when we started the SIBO Center in 2014. And I teach advanced gastroenterology at NUNM Medical University in Portland since 2013. And Dr. Sandberg-Lewis is a veteran gastroenterologist, phenomenal. He's been teaching for over 40 years. He's been teaching gastroenterology, pathology, and practicing even longer. So in this SIBO Center, I was the medical director of the SIBO Center for all the years that I was there. And we had other doctors working with us in the SIBO clinic and in the community. And what we did was we ran before and after SIBO breath tests for every treatment that we gave. So we had lots of immediate feedback and data to show us what worked and what didn't work for the different gases and the different SIBO types. We also created herbal antibiotic protocols and refined the protocols and doses over all the years we were there working together with our patients. And as we saw what worked and what could work better. So we spent many years doing this with more than 1,000 tests.
Can I just say something, Dr. Siebecker? Oh, sorry.
Yeah, go right ahead.
Mid-word there. Hang on. I got to show myself again. View, show non-video. Nope, that's you, Clarissa.
I can see you perfectly.
You can see me?
Oh, yeah.
Oh, good.
I think it just is a matter of, well, I don't know if anyone else can see Shivan. I can see you.
Like flossing my teeth or something. Oh, you can see me. Man, Amber, am I glad somebody told me that? I feel like an idiot because I was just like looking around, getting my stuff together from when I was going to talk. Okay, so I will fix that. Thank you, Mercury retrograde. Now I can see myself. Anyway, what I was going to say is you did how many tests?
Thousands. When we put it all together, because we had other doctors working with us. So it was myself, Dr. Sandberg-Lewis, at least 3 other doctors. Stephen and I actually tried to add up one time, actually how many tests we had run between him and I. Oh, yeah. And we lost count going over 2,000. It just, because this is what you have to understand. This is what I did for how many years. Every patient that I saw had SIBO. That's all I do, right? So all day long, every day, everybody has SIBO and everybody's getting before and after tests. So it racks up pretty quick. It
really does. Okay, thank you. I just wanted to hear you say that again because I don't even, how long have we worked together now? I don't even know if I realized that. I think it was a little bit of like force for the trees. I knew that it was worked, but I don't think I knew that part of it. And so I wanted to share that with everyone. It's okay. Thank you. Back to you.
Okay, so the other thing that we did was we used, besides the herbal antibiotic protocols that we developed, we used pharmaceutical antibiotics and elemental diet, which are the 2 other antimicrobial SIBO treatment types. And we used all 3 types equally, which is really quite unique because gastroenterologists tend to use pharmaceutical antibiotics and alternative focused practitioners tend to only use herbal antibiotics or elemental diet. But we use them all with before and after testing for every treatment we gave. And also we all met as a team every week for years to share our learning and to go over what we were seeing. And this gave the benefit of other doctors' experiences, as I was just mentioning, other tests, their patient populations, and it just exponentially increases learning because we have a larger patient sample and larger data. So that's how I know that the treatments that I use and that I'm going to share with you really work. It's because of extensive data before and after testing, as well as symptom tracking, of course, of thousands of treatments given to SIBO patients. So the 3 antimicrobial SIBO IMO treatments, as mentioned, are pharmaceutical antibiotics, herbal antibiotics, and elemental diet. 2 of the main treatment types here that we have for SIBO, meaning what reduces the overgrowth, are natural. So herbal antibiotics and elemental diet. And I point this out because this is always one of the highest requested topics for me to speak on, natural treatments for SIBO. So those are going to be herbal antibiotics and elemental diet. Antibiotics and herbal antibiotics protocols vary by gas type, but elemental diet works for all gas types. Now I'm going to start with the pharmaceutical antibiotics because it's brief and it sets the structure for the herbal antibiotics. We use 1 to 2 antibiotics at a time for 2, sometimes 3 weeks, and that equals one round. One treatment round is 2 weeks or 3 weeks. We use 3 weeks in higher gas scenarios where hydrogen or methane is above 45 or 50 parts per million. We find that we have minimal added benefit if we continue past 3 weeks usually. I've seen some cases where 4 weeks or longer did make a difference, especially with rifaximin, but it's not common. So I just mentioned rifaximin. Here are the pharmaceutical antibiotics we tend to use: rifaximin, neomycin, metronidazole, and nitazoxanide. I'm using the drug names because we have people from many countries watching, and the brand names are different in every country. So I'm sticking to the drug names. But I will just say for those US watchers, rifaximin is named Xifaxan here, and nitazoxanide is named Alinea. Metronidazole is named Flagyl here. It's different in different countries. Okay, so this is how it works. We use rifaximin for hydrogen, neomycin, metronidazole, and nitazoxanide for methane. We use rifaximin for hydrogen sulfide, and we are on the hunt for other antibiotics, and we have some that we're still testing and that some of our colleagues find to work, but I don't want to share anything unless I absolutely know it works. And then when we have mixed gas, we use combinations of these antibiotics. So something else that's important to know here is that hydrogen is converted into methane and or hydrogen sulfide by the methane or hydrogen sulfide producing microbes. And what this means is that we need antibiotics or herbal antibiotics to target both the hydrogen producing bugs as well as the methane bugs. And I'll show you that in a minute. And this is what Shivan was alluding to. If you have methane or hydrogen sulfide, you also have a problem with hydrogen because you had to have enough hydrogen to even make methane or hydrogen sulfide. And so we have to treat all of it. So this is how it works. Here are the protocols. For hydrogen, we use rifaximin. For methane or hydrogen plus methane, we use rifaximin plus either neomycin, metronidazole, or nitazoxanide. The rifaximin is for the hydrogen bugs. The neomycin, metronidazole, or nitazoxanide is for the methane bugs. For hydrogen sulfide, we can use rifaximin alone. That's good when there's diarrhea present. We can use rifaximin and neomycin when constipation or methane is present. And then we can use rifaximin plus either bismuth or oregano. Now, I'm categorizing those as herbal antibiotics, and I'll talk about them later, but we mix, if for hydrogen sulfide, we mix antibiotics and herbal antibiotics frequently. And the dose for oregano when used for hydrogen sulfide is different. And I do have a handout for you with these protocols. And at the end of the webinar, we'll give you a link to that handout. And Shivan will show you other resources.
Dr. Siebecker, I just want to do one thing and remind everyone, because I didn't say this before, this isn't medical advice, okay? You need to work with your practitioner if you're doing the scripts, for example, obviously, because you're going to need someone to prescribe it. And SB is just mentioning that antibiotics act badly with autoimmune medications. Please mention that. Of course, you want to check for drug interactions. This is not a doctor's visit, guys. You use this information so you can move forward. And right, so practical and so awesome. Go back to you, Dr. Siebecker. I just wanted to get
you
that
mentioned that not all antibiotics are as bad as you might think, and I'm not discussing that right at this moment. We can bring it up in Q&A, but if for those who don't know rifaximin, I am actually not sure of what that person said, whether rifaximin is bad for autoimmune disease. I think it may not be, unless this person has medical information, I don't know. Rifaximin is very, very different than other antibiotics. But I understand this person might have information I don't have. Now,
yeah,
the way we do this is for herbal. So I'm now going to herbal antibiotics.
yeah.
It's very similar. So that's why I wanted to show you the pharmaceuticals first. We do 1 or 2 herbs at a time. We have found that 3, 4, or more herbs do not work better than 2 herbs. So why do it? Why do it? And the duration is different than antibiotics. It's 4 weeks at base, sometimes 6 weeks. And that equals 1 round or course. And it's the same. I find that efficacy often wanes after 6 weeks. Now, some practitioners don't find that, but in my patients, I see it almost all the time. So it is something to just keep in the back of your mind that, just taking them forever. What happens is the person just starts to relapse while they're on them and they peter out in effect. Now, what about combination herbal antibiotic formulas? Many practitioners use big combination antimicrobial formulas. I will say that we abandoned that very early on because we needed much better control. We needed better control over our dosing. And also, many SIBO patients are sensitive and react to many supplements and herbs. So we needed to easily be able to identify what was bothering them and take it away or replace it. And it's much easier if you have single herbs that you're using instead of some massive formula. What are you supposed to do? All you can do is stop the formula. And then what, right? And just overall, we found single herbs to be simpler, streamlined, and very effective. So here are the herbs for SIBO and IMO for herbal antibiotics. For hydrogen, we use berberine, oregano, and neem. Berberine is a constituent that is in herbs like golden seal and Oregon grape. For methane, we use allicin and atrantil. Allicin is a constituent in garlic, from garlic. We do not use whole garlic pills, aged garlic pills, or garlic oil pills because they have very high FOS or fructans, which can trigger SIBO symptoms. So what the product that we used was called Alimed, also sold as Alimed Plus. And by the way, when I share brand names, I'm letting you know what we used in our patients and ran before and after tests on. And that's all. It's like, I can say that because this is continuing education. Usually I can't share brands. Now, atrantil is a 3-herb combination that's been studied for methane. For hydrogen sulfide, we use bismuth, oregano, or uva ursi. And we mix these together when we have a mixture of gases. So here's the protocols. Here's how it works. For hydrogen, we're going to use usually 2 of these 3 herbs. So berberine and neem, berberine and oregano, or oregano and neem. And the oregano that we used is by Biotics, and it's called ADP, and it's a dry tablet form of oregano. We just found this was better tolerated, particularly for people who have stomach issues and upper GI issues. For methane or hydrogen and methane together, we add allicin or atrantil to one of the hydrogen herbs. So it's going to be allicin or atrantil plus berberine or neem or oregano. Or you can use atrantil by itself. The hydrogen sulfide protocols are, we can just use bismuth alone or bismuth thiol complex, and I'll explain that in a minute, or oregano by itself. And here it's in a different dose than it is for hydrogen. We can use bismuth plus oregano. We can combine them. We can use uva ursi. So this would be oregano plus uva ursi or bismuth plus uva ursi. And there has been shown to be success with uva ursi plus silver. So later in the webinar, Shivan will show you a way to access more resources with further dose information, and we'll give you a handout of these protocols. So the way you get bismuth is standard Pepto-Bismol, right? You can just get Pepto-Bismol, but there is a drawback. All forms of Pepto-Bismol, even the swallowable pills, contain sugar alcohol, which can worsen or trigger SIBO symptoms. So in the US at least, I typically recommend Target's generic version of it in the swallowable pills, the caplets, because that has no sugar alcohol. The other way you can get bismuth is practitioners can compound it from a compounding pharmacy. Bismuth thiol complex is Dr. Paul Anderson's anti-biofilm formulas, and he has 2 forms of this. You can get it compounded as a prescription, and this is also known as Biosolve PA, or you can get it over the counter by the company Priority One. It's called Biofilm Phase 2 Advanced, and this can supply bismuth also. If you have mixed gases, for hydrogen and methane, you use the methane protocols. For hydrogen sulfide, the best thing to do is just add bismuth or bismuth thiol or oregano to the hydrogen or methane protocol that you're doing. Okay, now on to Elemental Diet. This is a medical food beverage of pre-digested, easily absorbed nutrients, and it usually comes in powder form. It works on a different principle than antibiotics or herbal antibiotics for SIBO and IMO. It starves the bacteria, but still feeds the patient. And this is because it's absorbed so easily and quickly within the first 2 feet of the small intestine. And as mentioned, it works for all gas types. A key point is that Elemental Diet can significantly decrease gas levels in 1-2 week course. We have seen it reduce gas by up to 150 parts per million. And the point here is this can really save a lot of treatment time. Because now, this is something I alluded to and I mentioned last time, but here it is again. Antibiotics and herbal antibiotics reduce gas by 30 parts per million. And by gas, I mean hydrogen and methane, on average, 30 parts per million per treatment round. Whereas Elemental Diet typically reduces gas by double that, on average 70 parts per million per treatment round. So this can save a lot of treatment time having to go through multiple rounds of antibiotics and herbal antibiotics in higher gas scenarios. It's drunk in place of all meals for 2 or 3 weeks. So it has the same, one treatment round is 2 weeks or possibly 3 weeks. So no solid food is eaten. It is okay to have black tea or coffee, but other than that, really, you're not consuming anything else than this drink. And that can be very challenging. And that is why most SIBO patients will try this treatment type last because nobody really much wants to do it, even though it gives all this incredible gas reduction, at least for most people. So here's how the protocol is done. You do the Elemental Diet for 14 days, and then you retest your SIBO on the day after you're done, which is day 15. So for those of you familiar with the test, there's a prep diet. The Elemental Diet becomes your prep diet on day 14. Now, Dr. Pimentel is the one who developed this protocol, and the way it was originally designed is you try to get your retest results back quickly, like you could maybe ask for overnight results, pay a special fee or something. Because if it's still positive, you want to know that quickly, because then the protocol is to continue on for a final and third week to just try and get that test negative. If the test is negative, though, on day 15, then fantastic, your SIBO's gone, and now you move on to prevention treatment. Now, a caveat here is, if you know that you're not willing to continue for a third week, then you don't need to get the test results fast. You can just go onto your prokinetic while you wait for the test results, because if it's positive, you know that you're going to choose antibiotics or herbal antibiotics next. You don't want to do any more of the Elemental Diet. We also stop all non-essential medicines and supplements during it. You would, of course, be talking to your practitioners here. Don't stop anything without checking with the person who has prescribed it. But we always stay on essential medicines. And then we don't do antibiotics or herbal antibiotics concurrently because the bacteria are hibernating and during this treatment, and they need to be replicating for successful antibiotic or herbal antibiotic treatment. So it's just a waste. And actually it's a bit counterproductive, particularly with herbs. So here are the brands of Elemental Diet. Some formulas you can buy yourself directly online, and these are listed in the top of the screen. Some Elemental Diets have to be purchased through practitioners, and those are listed on the bottom of the screen. The top one, Vivinex Plus, was the one Dr. Pimentel used in his study on Elemental Diet for SIBO. So that is the one we have the study for. However, we know from our experience that these other formulas work as well. Now, right here, this homemade, what this is about is way back in, God, when was it? It was probably like 2012. I can't remember. It was a long time ago. I created recipes for how to make your own homemade Elemental Diet where you buy the components, because back then, all we had was Vivinex Plus. We didn't have any of these brands. We had Neocate Jr., but Vivinex Plus and Neocate, particularly Vivinex, were very expensive. And my patients just couldn't afford it. And so I made these recipes so that it would be more affordable. There are some other advantages to these too, but we're going to, at the end of the webinar, with the other links for the handouts, we'll give you a link to this.
Right, but also doesn't the elemental diet from Vivinex and all that tasted like vomit?
Yeah,
so,
but yes, but so does my homemade recipes, because there's no, because there's
Okay.
no flavoring in it. All of the other ones that you see on the screen have flavoring in it. But, back then, what we would do, believe it or not, what Dr. Pimentel's protocol was, recommendation was to buy Crystal Light, which isn't a healthy thing, but it gave you a little bit of sweetener and a little bit of flavoring. And then you would just add a little bit of that. There's different ways you can add flavoring. So, here's an important point. There are a lot of intricacies to know about for going through this protocol, and I'm not discussing them today. But again, later in the webinar, Shivan will show you a way to get access to resources with all of that information and the handout on my recipes. Okay, so now I've gone through the 3 treatment types. I want to talk about some key treatment points, just some key points actually, for when the treatments don't work. And by that, I mean, when a treatment doesn't lower gas, which we need a retest to see. We cannot judge whether a treatment works or doesn't work by symptoms alone. And the reason why is the first point. Symptoms may not improve with the first treatment round. And this is because antibiotics and herbal antibiotics typically lower gas about 30 parts per million per treatment round. So if someone has gas higher than about 45 or 50, hydrogen or methane, one round may not eliminate that gas and that overgrowth. And until the overgrowth is eliminated, there can still be symptoms. And especially this is the case when the gas is very high, like over 100 parts per million, because you may not feel any relief until we can get that gas significantly lower. And this might take 2 or 3 rounds. Next is 100% symptom relief is not expected in 2/3 of cases. These are the amount of cases that statistically are chronic relapsing. And that's the focus of the 3rd webinar in the series. So don't miss that if you want to learn more about it. The reason cases relapse is because there's usually an underlying cause which is still present and causing SIBO. And those underlying conditions can often cause symptoms of SIBO even when the SIBO is not present, because they have symptoms of their own that they generate. So we always I shoot for 90% symptom relief, and we often get 90% symptom relief, but it may not be 100%. So if you're using 100% to judge whether a treatment worked, I would recommend you switch it down to 90. And Shivan was mentioning this last time. For most of us, when we think of antibiotics and infection, and here, we have a slightly different situation than that, like an acute infection, we're used to going and getting an antibiotic, and by the time the treatment's finished, we're 100% better. So this is a little different. Wait a minute. All SIBO treatments may not work, meaning reduce gas, on every single person. Sometimes a particular treatment just doesn't click with a particular individual, but that same treatment works phenomenally for most everyone else. So if that happens, just try a different treatment. Don't expect perfection from every treatment option. Sometimes only one of the treatment types will work in a given individual, meaning antibiotic, herbal antibiotic, or elemental diet. We see this actually pretty commonly, and I just assume maybe a person's particular overgrowth isn't quite sensitive to whatever agents or agent we were using. I'm not really sure why. I just know it happens. So if that happens, the thing to do is just try a different treatment type. Vary the treatment between antibiotics, herbal antibiotics, and elemental diet. This one can be problematic for those who don't know about all three treatment types. Like I was mentioning, certain practitioners don't know about them all. Or philosophically, if someone does not want to use one or more types, or if your practitioner can't prescribe antibiotics, for example. But in that scenario, if herbal antibiotics and elemental diet aren't working, I've seen that scenario many times, then this is a good time to consider pharmaceutical antibiotics. And you could always ask your primary care prescriber or whomever it is you see that can prescribe for the antibiotics on the advice of your SIBO practitioner, and then keep working with your SIBO practitioner. This is something I'm very familiar with because I've been doing telemedicine for a very long time. And when I see someone on telemedicine, I cannot prescribe for them according to my license. So I deal with this with my own patients all the time. Now, the last one is the worst one. What if you have a tough case? What is a tough case? When multiple appropriate SIBO treatments don't reduce gas or symptoms, or only offer minimal temporary help. So I see patients all the time who say they have a tough case because one or possibly two treatments didn't eradicate SIBO and their practitioner didn't try anything else. And that's not a tough case. A tough case is when several treatments have been tried, both from within the same category, like herbal antibiotics, and a different category, meaning you've tried all three treatment types. And of course, you've been properly diagnosed with a test and you've been retested after treatments. Then that's a tough case. SIBO treatments truly aren't working. This almost always means something else is going on, like mold illness, mold exposure, which is something we've been focusing on in our educational teachings for quite some time now. And we do have more coming up on that in the future. So the key point to think about today is if you thought you were a tough case when maybe you just gave up too soon because you didn't know about all the things I've been sharing. Do you know your type of SIBO or IMO? Have you had hydrogen sulfide tested? Did you know the specific treatment protocols for each gas type? And that multiple treatment rounds are usually needed? And have you retested to see if gas is reducing? Have you tried different treatment types or only stuck with one type? If any of this applies to you, it's actually really good news because you may have a really good prognosis in your future because most cases are not tough. So on that positive note, I will end.
Okay, so how many of you are feeling hopeful? And yes, I want to share with you. Thank you, Dr. Siebecker. That was amazing. That was amazing. Truly. I want to share my screen and just give you a couple of little tidbits here. Stay until the end. I'll show you why. I know a lot of people are asking who came in late. Yes, please do pop in some love for Dr. Siebecker into the chat. Now's the time to use the chat. Thank you all for refraining from using the chat during lessons. I appreciate it. I can't remember what I was just going to say. I wanted to show you something fun. Do you see a little picture of Dr. Siebecker?
Yeah, I can see this.
Okay, so just a little backstory. So this is Dr. Siebecker with her award. This is me with my book, Healing SIBO. Thank you all if you've bought it. If you have, please leave a nice review on Amazon so other people can get turned on to it. Dr. Siebecker wrote the foreword to it, read every word, and I pretty much talk about her the entire book. And that has the algorithm in it that I'm going to talk to you about in a second. We've become friends, thanks. We've traveled together, working together, gone to conferences together because she not only was my doctor, but we shared this mission of getting the word out to help people help themselves. And, you know, my platform is SIBO SOS. The SOS means save ourselves. Yes, work with your practitioners. Yes, do as much as you can yourself. You'll be so glad you did. This is us deciding, yay, we deserve to go to the beach after we recorded all of the SIBO Recovery Roadmap program in Florida. And then this is just me being on TV. And then this is us at a conference. You may recognize some faces there. This is Miles, our videographer. And then this is our team on a very intense meeting. I can see we've seen better days. Here's why you should stay until the end. We are going to share with you the recording. Yes, get that in your email, but also that list of the SIBO and IMO antibacterial agents, along with the algorithm and Dr. Siebecker's favorite cake recipe. So that is going to be yummers. And what I wanted to invite you to do, if you are, so I wanted to show you something here. So I know, do you see the algorithm, Dr. Siebecker?
Yeah, I see it.
Okay. Oh boy, it's big. So this is the algorithm that Dr. Siebecker was just working from, okay? You will be getting this in, if you stay until the end, we will give you a link, okay? Now what I have that I wanted to show you in case anybody here, and I know you are, is part of the SIBO Recovery Roadmap program already. And if you're not, that's fine. This is what she just taught, right? So she just taught treatments up here, SIBO treatments for the 3 gases. I don't have my laser pointer on, but you go to, when you are enrolled in the course, you can click SIBO treatment and treatment prevention. So it goes right to, like, wherever you are on the algorithm, you just click this link and when that's enclosed into the course, and it takes you there. So we have made this program, for those of you who want to continue with a deeper dive, very, very user-friendly and so fast and easy to access. So as you can tell, Dr. Siebecker is an excellent teacher, and that's why she has been asked to speak around the world and has done such a beautiful job educating the professionals as well as the patients. So thank you. But what I did was I asked her to create a resource for us, and that is the SIBO Recovery Roadmap. And that is that algorithm that she talked about in the first training so extensively. So I just wanted to sort of connect those dots for you. For those of you like Amber, you already bought the course. I'm not sure if you have had a chance to dive in yet. I doubt it. It's been like, 24 hours or something. So I just wanted to show you how that works. Okay. Who is surprised by some of this information? Pop that into the chat. Do you all feel like, oh my gosh, I didn't know that? Who feels also some hope from this information? I am very, very hopeful. I'm relieved. Thanks, Martha. The Essentials program is not the same as the SIBO Recovery Roadmap. It is in the SIBO Recovery Roadmap, but it is not the same. That's 4 lessons. This is like 69 or something. You will get the recording, Connie, so hang out until the end. Finally gotten the information I need to, okay, good guidance, excellent. Okay, I just wanted to share that love because it's lonely. It's really lonely. I'm telling you, it's lonely. It's lonely. And so I know a lot of us have been frustrated in the past with multiple rounds. Glad that Diana's not surprised because she's stuck with us in so many webinars and trainings already. Okay, good for you, Diana. I love that. Okay.
That means Diana's a good learner.
Yes, yes. Right. So the word learner, Dr. Siebecker, I'm so glad you just said that. Maria, after 12 years, finally hope. We want you to take information that you learn and turn it into thinking. So I had somebody say that to us after a training. You just turned my learning into thinking. Like, I now know what to do next, which is the beauty of this algorithm. So, and Dr. Siebecker's teachings. So that's very exciting to us. Very, very exciting, because we want to nurture and educate and then go. And then if you have to come back, that's cool too. We love that. But this is why we've done this, is because I asked Dr. Siebecker to help me with my mission of getting the word out. And she did. And she's like, oh, that's my mission too. So let's do it. I asked her to make this course because this is the information I wish I had had when I first got diagnosed. Remember, I've had SIBO at 5 from food poisoning, multiple rounds of food poisoning from traveling to India and from milking a cow in upstate New York and drinking some of the milk without it being pasteurized. I was a city girl. Don't even ask. So this is very exciting for both of us because we know the difference that this can make. So I really appreciate you typing in that that you feel hope from here. If you have a piece of paper and a pencil and you want to just jot down your next action step because you need to remind yourself, feel free to do that. I get it. It's hard to brain fog. It's hard to keep everything straight. Okay. Now that you've been posting, thank you so much for doing that in the chat and jotting it down. I want you to know how you can get a hold of the interactive algorithm, and you can fill in the gaps of all of this. This has been about, an hour of solid teaching, and that's where this next step comes into play. So it's going to be like having Dr. Siebecker as your personal tutor. So I wanted to hit this one more time, Dr. Siebecker, to show this to you all. So this is about if you are not better and you are a tough case. SIBO diet. Remember, Dr. Siebecker is the one who created the SIBO specific food guide that is a combination of so many other food, FODMAP, low FODMAP, blah, blah plans, SCD, etc.
It's SCD and low FODMAP.
Together. together, married in
with
this-
my own changes. And then many of you may know my friend, Dr. Narala Jacoby, she took my diet and then she put my diet into phases, and she calls that the SIBO biphasic diet. So hers is a variation of mine.
It tells you like what to do when, whereas for me, I'm a super taster and a super picky person and a vegetarian. So I went to Dr. Siebecker's SIBO specific food guide and chose what I was going to do. So it's just been an astonishing accomplishment, Dr. Siebecker, of what you've done. So you click the link and there you go. These are the lessons, and some of them are long, some of them are short, because we just get you the information you need right away. And this was the idea. Okay, that was 2 minutes and 45 seconds. SIBO types updated, 14 minutes and 57 seconds. Somebody just said that she's on 5.2. So lesson 5.2, underlying causes. Hello. Can you imagine how you would feel if you figured out your underlying cause? I know how I felt. I had just been treating SIBO, treating, and I didn't understand my underlying cause or how important prokinetic was. And that's what Dr. Siebecker is going to be talking about in the training number 3. But once I knew what my underlying cause was, my whole world opened up. So I was able to really sort of take it to another level. So that's also in there. Anyway, I just wanted to say thank you so much for being here. You want to stick to the end. We are going to do Q&A. And let me show you one other thing. So this is what they look like. Going back to Zoom here, share screen. This is what they look like. You're going to be getting Dr. Siebecker's cake recipe. You're going to be getting the algorithm. Those links don't take you to the inside of the course, but they will give you a way to order if you want to enroll. And then you're getting that protocol. So I just wanted to show that to you one more time. And then I wanted to make sure that you were putting your questions in the Q&A and that you realize that there is hope. This is the point. There is absolutely positively hope. You are not alone. And it's very exciting to know that there is a program out there that can help you and that can liberate you. We're all about liberation here. We want to make sure that you have the information that you need, and we have specials for you if you did decide to join us. The other thing about this course that I just wanted to mention, oh, by the way, you'll have access to the webinars ongoing, and people ask about, a frequently asked question is, how long do you have access to the course? We were told by our lawyer not to say a lifetime. So just shall I say you have unlimited access to the course, and we don't drip it, right? Because this was something that Dr. Siebecker and I felt very strongly about. We don't drip it. We let you have all of it right away so that you don't feel like, oh, wait, I want to know the lesson about my underlying cause. You don't have to wait 3 weeks for that, right? So Clarissa, if you would pop the link in there, I'd really appreciate it so people can access it. And then I wanted to show you something else, and then we will move on to some questions in a minute. Let's see. Okay, so wait a minute. Share, Shivan. Hello, share. I got that. Okay. Are you ready? We have some special bonuses for you. Here it is. Okay, share. Do you see this now? Do you see the stay until the end?
I do.
Okay, great. So you are going to be also receiving cooking classes if you decide to join us. You'll also, for the first few people, be getting a copy of my book in PDF if you decide to join. And so I just want to make sure the link is in there. I'm telling you guys how to do it, but all the goodies, but I just want to make sure the link is in the chat. I don't know. Clarissa, were you able? There it is. Thank you. And then what we're also doing for those people who decide to sign up now is the Tea Cozy Happy Hour. So I'm corny. Okay, so just that's the Tea Cozy part of it. But what came up was that people actually wanted to talk to me and do brainstorming sessions. So I have included that as one of the bonuses if you sign up now during the webinar. And then you're getting the cake recipe. And this is a really heartfelt set of testimonials from people that have taken this class. Gratitude to Shivan and Dr. Siebecker. This is from Maya. And she said, I'm so glad I trusted my instincts and signed up. Having been newly diagnosed and still knowing very little, I had no idea if spending the money would be worth it. I get it, please believe me. But I just had a sense that I should go for it. Now I'm so very happy I did. There's been so much offered and has been so useful that the price now seems like a very small price to have paid. A big thank you all. That's so cool. So cool. We have more. I mean, we have hundreds of them. Seriously, I just finished lesson 27 in the course and I can't describe how grateful I am for all this info. I think I would pay for my doctor to take the course. I totally get that. So on and on, people know what to do next. If you're already enrolled, Martha, I'm going to answer your question right now. Okay, so here's the deal that's so cool about this course. Thank you, Dr. Siebecker. This is a living, breathing course. It is updated. So we have gone in and updated it periodically when there was breaking news, right? When it was worthwhile updating. So I know I've spent thousands of dollars on courses in the past and it was a one and done. And I didn't get updates. And I wondered, well, what have they learned about fill in the blank since I bought this course? We are committed to keeping you updated. So the course is updated. Now, for this semester, for lack of a better term, for the people who decide to join us for the January 2022 class, you are getting 8 Q&As. Now that is humongo, and I'll tell you why, because what you're about to experience is Dr. Siebecker answering Q&A, and she's very, very good at it. And last year we didn't do any because Dr. Siebecker was in deep cabin mode writing her book. Now, Martha, you're going to love this if you don't know this already. If you have purchased it since we started doing the SIBO Recovery Roadmap, you will be able to go to 6 of those Q&As in 2022. So that is so cool. You make this investment, obviously, right? No one's static. Things are going to change. You're going to have a question about this. You're going to want to get another treatment round, whatever. This is going to be updated and you're going to be able to attend those Q&As. Patients and students from let's say last year, year before, they were coming to Q&As that we were doing that year, even if they had signed up prior. So you get the point. It's going forward into perpetuity for 2022. We will be supporting you with question and answer sessions, 8 of them if you sign up right now. And if you're already a student, you will be coming to 6 of those and we'll email those to you, no problem. So we're very excited. Clarissa, if you would once again put in the chat if you want to sign up, thank you very much. And I know for a fact one person just bought, so we will count you in. And I wanted to let you know that the next person who signs up is going to get a free 15-minute consult with Dr. Siebecker. So we just had a couple of those and that's it because Dr. Siebecker is so busy, but we wanted to give you a little juicy goodie for joining us. This could be you being happy. I can't wait until I can get my swing. I haven't shared my screen. I'll do that later because I want to get to the Q&As. The cost, let me show you that. Actually, I do want to answer your question there. And I am going to need that. So that's me being happy on my swing. Not really, but I'd love a swing. I want you all to imagine yourself feeling fantastic, having SIBO in your rear view mirror and absolutely getting this frustration, loneliness, not to mention the physicality of it, behind you. There is hope. And remember that even if you manage a condition that is chronic, you can feel 100% better than an unmanaged condition. There's absolutely hope and we are here for you. So here's the offer. It's $200 off right now. You're getting the 8 Q&As. You're getting just a little pretty picture of it all. The 8 live Q&A sessions, the updates like no other course I've ever seen. Instant unlimited access, 36 video lessons. They're more than that. Professional searchable transcripts, easy for me to say. So when you get the transcripts, it's really cool because you can type in a keyword for the search and there it comes. So this is another way to access the information very quickly and easily. To answer someone else's questions, this is different than our SIBO Essentials. is included. We do include it in this course because it's a great beginner level basic. You don't have to watch that first, but we find a lot of people do enjoy that. Plus you're getting tons of handouts, guides, research studies, bonus classes, and that Facebook community, I'm telling you, it's gold. That is 22,000 people going strong, and it's normally $4.99, but we do have it at $2.98 right now. So this is what is the URL. Plus I know it's in your chat. So it's sibosos.com/exclusive. So I hope you're going to join us and continue this learning so you can apply it to your thinking and you can change the way that you experience your future and be well. Be well. I'm very excited about this, obviously. Okay, Dr. Siebecker, are you ready for some Q&A, my friend?
Absolutely.
Okay, here we go. So this is a related question. Could you explain from the slide with the Trio Smart test why you do it longer? And Dr. Pimentel is about the 2 hours, you're about the longer. So can you explain that, please?
Absolutely. Yeah. When we run a SIBO breath test, when we take our samples for 3 hours, what that's doing in most cases is giving us a view in that third hour of what's going on in the large intestine. And this is really important because since methanogens can overgrow in the large intestine as well, I want to see how high the methane gas is going to go during that large intestine time period. You know, we could continue the test longer and keep getting longer views of the large intestine, but we find that third hour is sufficient. That is sufficient. I want to know how high the gas goes because that's how we predict the number of treatment courses that we're going to need and helps us decide whether we should advise or whether the person should take an elemental diet. You know, because if the gas is 175 parts per million, that might change that person's decision about whether they want to do that challenging elemental diet or not if the methane gas only got to 40, right? So we need to know the extent of the severity. And for methane, we use all 3 hours of the test. It is not about the first 90 minutes. So Dr. Pimentel has done some research recently that showed the best prediction and the best timing in his estimation to diagnose hydrogen gas is within 90 minutes. But that is not the case for methane gas. We use all 3 hours. Hydrogen sulfide, it's similar in that also can exist in that third hour. That can also overgrow in the large intestine. And so again, what if it wasn't positive until that later time with hydrogen sulfide? We would miss it. That's not common, but I don't want to have to go back and do another test. I want to do everything I can do. In my estimation, there is no downside to doing 3 hours, right? All it requires is 1 extra hour from you. You're committing 2 hours anyway if you were doing Trio Smart. And so that's why we do it. Now, the Trio Smart folks, the wonderful folks there, and Dr. Pimentel, they know my opinion, but they still are deciding to offer a 2-hour test. So I talked to them about this. And what you can do is extend your samples out. Instead of taking them every 15 minutes, you take them every 20 minutes. And at least that gets us to 2 hours and 40 minutes. There are some other configurations that you can do, but you know, this has to be ordered by a practitioner anyway. So hopefully you're working with a knowledgeable practitioner and they know and can advise. But my general advice is take your samples every 20 minutes and extend it to 2 hours and 40 minutes. And that is absolutely fine to do. I have cleared this with the Trio Smart folks. The graph will just properly represent that. And there's no trouble with doing that. So that is the reason why. And I will say one other thing is that, you know, I have extensive clinical, obviously I have extensive clinical experience with SIBO breath testing before and after and with treating SIBO patients. And for hydrogen, I have case after case, and I often teach these cases of examples where if we only went to 90 minutes, we would have missed the case. And so for hydrogen, I go to 2 hours because once again, I don't want to miss anyone. So in terms of interpretation, I'm talking about interpretation here. So I use 2 hours as my positive cutoff for hydrogen because I've had so many examples of people that have been missed that truly have it. And the manufacturer uses 2 hours. We all always used 2 hours. So I stick with what I know works. So that's my for interpretation for anyone who's here who knows about all that.
Okay, thank you for explaining that, because there was a little bit of, we were wondering. So
Yeah.
I know you've explained it before, but you've approved it with, like that's the thing. You're so collaborative, Dr. Siebecker, and you are updated when, things change so quickly, and then we get it out as soon as possible to course participants and, with the work that we're doing. So thank you for explaining that. Okay. Let's see. Okay. Martha, I hope you're coming to the class tomorrow, or not tomorrow. What day is it, Allison? The next training.
In 2 days.
In 2 days on prokinetics.
Well, and all about relapse and chronic and how to deal with that whole spectrum of things.
So Holly's asking about the hormone connection. Do you see that a lot, like with thyroid patients and the like?
Oh goodness, yes. So so we know that in the condition of hypothyroid, typically there's constipation as a symptom. In hyperthyroid, typically there's diarrhea. Well, it has been shown in several studies that hypothyroid can be a cause of SIBO. And that is because it slows the motility in the small intestine. And that is the number one physiologic, meaning in the body, cause of SIBO is slow motility in the small intestine. And that might be confusing to hear about for people who have diarrhea, because you can have slow motility in the small intestine causing SIBO, and then you have the overgrown microbes of SIBO are making hydrogen gas, which then gives you diarrhea or hydrogen sulfide gas. So you can have slow motility in the small intestine and even fast motility in the large intestine. But anyway, back to thyroid. That is one of the connections, one of the causes of SIBO. And we also know that so many women with their monthly periods will get constipated either premenopause, usually premenopausally. So not menopause, menstrual, sorry, PMS, not menopause, PMS. And that's usually because of the progesterone. The progesterone slows motility. And then, typically when the period comes, that alleviates. So then the progesterone levels are dropping at that point. So there can be issues with people's hormones that can lead them to have SIBO. So that's always something we recommend, that I always recommend, is make sure you've had your hormones tested and everything is in order. Because if they're not, we might have a hard time progressing forward. We might get relapses of SIBO.
Guys, please put your questions in the Q&A box. The chat is just for links and tech issues. Okay, thank you. So this is a great question from Judith. Hi, Shivan and Dr. Siebecker. Hi, Judith. My daughter is a college athlete. Good for her, with zero free time over her winter break. So just, a couple months ago, right? Last month, she tested and was treated for hydrogen and methane with pharmaceutical antibiotics. She's much better, but not 90% of the way there. Unfortunately, she won't have time to retest until the summer. Would you recommend that after 2 weeks, she retreat with herbals? Because she can't retest.
Okay, so she's had, did I hear 1 round of pharmaceuticals?
Yeah, 1 round. Mm-hmm.
And she's not 90% better and she cannot retest. Right. Should she just move on and take herbals? Yeah, I mean, I think that's reasonable. Because we already know she had SIBO, right? She was diagnosed properly.
Yes. Yeah.
Okay. Yeah. So then I think that's absolutely reasonable to try that. Yep. And then if you know how high her gas levels were, also that would make a big difference here. Do we know how high her gas levels were? Because
that wasn't in there, but that's such a good point, and you'll learn about this in the course, and we talk about it all the time. You got to get that report and find out that number. Don't just because let somebody tell you pro or positive
then,
or negative.
You can estimate how 30 parts per million is the average. Of course, sometimes it's more, that antibiotics can bring the gas down, and you can already know ahead, well, I think she's going to need 3 rounds or 2 rounds. And so then you can feel more reasonable about going ahead to the second round without a retest. So that would be my advice, is take a look at how high, and, you know, of course, then you have to understand how to interpret. When I say how high, you have to know, I gave you some of that information, but you know, what you're looking at there, but you get a sense of it. But what I would say is, you know, I usually recommend after 2 or 3 courses of treatment is when you should get a retest if things aren't improving, because you don't want to let that go on too long. You need to know, is it gone? And is something else the culprit? You know, you don't want to be barking up the wrong tree, because some people just, there are some people who don't know this information. And so, you know, they're treating for 1.5 years and they've never retested. You just don't want to get into that.
Right. And Holly, that answers your question. Lena is asking, oh, by the way, thank you all. The two sessions with Dr. Siebecker are definitely all taken, but because I'm feeling the love, anybody who signs up in the next half an hour, because we're going till 6, would definitely get the PDF of my book. And just wanted to give you a little to help you get there. All right. So bring it on in, guys. Come on. We want to help you, and we want to get those 8 Q&As to you. And I'm really looking forward to my brainstorming session with you. Lena's asking, hydrogen sulfide can be with also alternating diarrhea and constipation, not just purely diarrhea or purely constipation, question mark. I'm going to start there. Is that true?
I haven't seen that yet. If it is, where I think that would happen is when all 3 gases are present. We had that on a chart that, you know, if it's hydrogen, methane, and hydrogen sulfide, we're a little unsure yet, because we've only had the test out for 1 year. So, you know, we're still learning, but I could see that absolutely happening in that scenario. Like the hydrogen sulfide just by itself, I don't see alternating pattern with, but I think if it's mixed with other gases, we're more likely to see that.
Okay. With the metronidazole, Dorothy, our dear Dorothy, hi Dorothy.
Oh, hi Dorothy.
Hi Dorothy, who's one of our students. She's following the treatment protocol and started with rifaximin and metronidazole. Does metronidazole kill the good microbiome?
Yes, it does. Metronidazole is a traditional antibiotic, and it affects, it's more like your standard get everything where it hits. So that's just unfortunate. Neomycin is specific. Wait a minute. No, neomycin does the same thing, and rifaximin does not. There's something niggling my brain here about neomycin that I'm not remembering, but rifaximin does not affect the microbiome negatively. As many of you know, it increases lactobacillus bifidus. And I remembered the new one. There's a new one that was just studied. I have it here on my desk. It's Faecalibacterium. So that doesn't carpet bomb, but yeah, metronidazole does.
Okay. Okay. So the questions that I'm answering are in the Q&A box, guys. Thank you very much. So Gail, you're getting the book. Oh, I feel like Oprah. You get a book and you get a book. Sorry, I couldn't resist. What if so it's the PDF, remember, otherwise I'm gonna be at the post office all day. Let's see. I just hold on for a second. Can chemotherapy cause SIBO, Dr. Siebecker? Have you ever seen that?
We have a lot of studies on radiation induced cause, but I don't know about chemotherapy specifically. I don't know one way or the other.
Right. Okay.
You know, one thing you could do is it okay if I tell them about a resource on my website?
Well, I would love to keep going though, because
Okay.
I'm going to have these people hate me.
Okay, keep going.
And I don't want that. That will hurt my feelings. Okay. And I don't want to hurt their feelings. Okay. So Genova diagnostic stool test, one indicator was Methylbrevibacter smithii, which was high. Can I assume I have methane SIBO? Brilliant question, Cheryl.
Yeah, no, you can't, because they're 2 different organs, the large and small intestine. And, you know, this has been some of the most interesting work that Dr. Pimentel has come out with recently, is that he is finally undergoing, no one had done this yet, full mapping of the microbiome of the small intestine. And this is new research. All of it has been done on the large intestine. And anyway, what his study after study of his has revealed is that they are completely different. So we cannot assume that if it's there in the large intestine, that it's there in the small intestine. And even though I said that it can overgrow in the large intestine, we don't know what that looks like on a stool test yet. And so you really have to get the breath test to find out, and you have to do a more than a 2-hour.
Okay. If you have both hydrogen and methane types, but methane is predominant, meaning a higher number.
And there's constipation probably.
And there's, okay, she doesn't say that, but does she have IMO? Is that the way it should be interpreted?
No, back on that chart, which, was in the PowerPoint. Sorry, just bringing your mind back to it. There was a place where it says, hydrogen and methane, that was previously called SIBO. Now that's called SIBO and IMO. Okay, even cool. If the methane is predominant, when you have, because methane, positive methane gas, the new name is IMO. So whenever there's positive methane gas, we would use the word IMO instead of SIBO.
Okay.
So now that's SIBO and IMO. And I will say, this is one of my concerns about this new name. Although I like it, I have concerns, which is that I've actually had patients who, when they're converting back and forth, because that happens often, we convert back and forth to these hydrogen and methane. One patient said, well, when I first started, I had SIBO, but now I have SIBO and IMO, and because then methane gas actually appeared. And they're like, now they're all anxious because they're like, now I have 2 conditions. It isn't like that. Before it was 1 condition. Now, just because we have this name change, now it's considered 2. So my advice is, don't use anything of this to increase your anxiety. It's already high enough, right?
Exactly. And I'm so glad you said that, because I have a phrase and it is called SIBO panic. And you see, any question that you could possibly ask, I have asked. I was so precise in my thinking and logical, and I was all Googling and all highlighting all the PubMed. I mean, I spent the amount of time I spent doing the research with Dr. Google and praying and thinking and trying to figure this out. All of that is going to evaporate for those of you who are in that state with this course. And that is why it is developed, for that precise reason, because it is a series of rabbit holes. I lost at least 1.5 years, at least, with, how can I say this? With a very nice professional who is in some of these circles, and it was just a waste. It wasn't a waste of time, because I probably was reducing the gas levels, but there was no retesting. There was no prokinetic. And I just was like, so frustrated. Sorry, this is very frustrating. Can you relate? All right. Are you familiar with the small handheld device Air 2 by Food Marble that measures hydrogen gas? I know you and I are both excited about that. Stand by. We're working on getting you some information about that. So this is, we did say, or I did, that we would talk about a more affordable way to get Xifaxan or rifaximin in the United States and some alternatives. Do you have some suggestions about that?
Yes. Everybody's always so interested in generic. I had to think of the word generic rifaximin. We don't officially have generic rifaximin in the United States. Now, I don't know what the cost is in other countries, but in the United States, rifaximin is, hugely expensive. And all of us practitioners are very upset about it. We have been all along. So in the very beginning, what we did was we went to Canadian pharmacies that are online, and we ordered rifaximin, and it all came from India, generic. And it was, it didn't work out. It didn't work out. It gave our patients symptoms that weren't just die-off or anything like that. And it wasn't effective. And we had a very bad experience with it. Now, hold on, there's going to be a better aspect to the story. But then some of our colleagues found, apparently there's just different brands from different manufacturers, and they found some brands that they had good success with, and they were different than the brands that I used. At the same time, I still have seen patients where like that was actually the whole crux of their case, is that this one patient I had who lived in the Caribbean was Indian, and she was getting her own rifaximin from India. I don't know what brand it was because I was doing telemedicine with her. And the whole key was, I finally sent her to Dr. Pimentel because I was like, needed extra help. And the whole key was she just needed branded rifaximin. And he just put her on, branded rifaximin, and she immediately had a good result. So I just want you to understand there are issues with generic rifaximin. Now I'm going to tell you what my colleagues have told me that has been working well for them. I haven't used it. Okay. So I always want to clarify this is coming on the advice of someone else. And that is through Mark's Marine Pharmacy. And it's called Ricifax, RCIFAX. And I don't know if patients can order that themselves. I just wanted to let you know about one generic version of rifaximin that my colleagues have told me they have had clinical success with and hasn't caused problems. Now, another thing you can do is a lot of the Canadian pharmacies, there's a million names of them. You can order branded, when I say branded, I mean non-generic. The manufacturer is Salix. You can get that usually typically from Italy. It may be from another country, but typically from Italy, and that will be half the price of rifaximin if you're concerned about the version or the brand of generic that is being offered. So that's what I can speak to as ways to get it cheaper. And also, Salix has had a patient assistance program all along. And they used to have one that was for financially, depending upon your income, your household income, they could give you. I'm not sure they have that one anymore. Maybe they do. We have actually those forms in the course. You can look for those forms, and they have one where I can't remember, but just look up patient assistance program, Salix patient assistance.
And I think it's not that hard to find, truly. Why are some of the studies still unpublished? If they were published, more GIs and MDs would be well informed regarding SIBO.
Oh, this is such a good question.
Yeah.
It turns out doing research is an entire career field unto itself. And any clinician, by that I mean like a practicing doctor who sees patients, who also does research, I hold them in the highest esteem and regard. They're doing two jobs at once. So the wonderful Dr. Weinstock does this. He's just, he's in private practice, and he gets together his information from his patients, and he does it. You have to follow all these federal guidelines, and it costs a lot of money. But he does it, and he publishes what he finds. He's another one of our phenomenal researchers, and we often feature him as a speaker. So it is extremely difficult for people in practice to get their results published. It's a whole other job. Usually you have to hire all kinds of people to help you. So, we have reams of data from all the years of our SIBO Center when we were working there. None of it's published. And I even connected with people who I found out were really interested in research, and they just, they would just drop off like flies. And then some of them went on to become SIBO specialists and practitioners and tried to publish their own research and have never published any of it. So, this is actually one of my dreams is winning the lottery, or somehow, getting tons of money and funding the research we need of all these treatments that we've done. We have before and afters, and and I would love to get them published, but it's difficult. And by the way, one of my covering doctors, Dr. Goldenberg, is a researcher, and he put together a survey for hydrogen sulfide, which I and Shivan keep emailing everyone to participate in it. Practitioners have to do it, but if you're a patient, of course, you can ask your practitioner to do it. That is a preliminary study, that survey, which allows us to then go on and publish. So it's part of the whole process in research.
Okay, we're getting questions about, I'm sorry, I was listening.
You don't need to, go right ahead, go right ahead.
It didn't appear as if I was, with me saying, oh, okay. But I wanted to, people were asking about the link. Do you see it, the big pretty pink picture? Do you see that right there? It's sibosos.com/exclusive. I'm going to keep that up for a minute. Dr. Siebecker, this is from Karen. She is very concerned about weight loss. So she's lost 20% of her body weight. And I know you and I talk very much extensively about this. There's also information in the course about this. Could you repeat again what a tough case is? She has scleroderma.
Oh yeah, scleroderma. I'm so sorry. Scleroderma is a forever cause of SIBO, so to speak. But I do want you to know that all the scleroderma patients that I've had have actually done really, really well in terms of their SIBO. Because they're always, I assume you're on a prokinetic. It's standard course of treatment for scleroderma, and they're always on usually more than one, and really strong ones, really good ones. And what I find is if you do the, I don't find scleroderma patients to be tough cases. Actually, you're going to always be a chronic or recurring or relapsing case because you have an underlying condition that continually causes it. But what I find is that we do antibiotics or herbal antibiotics, whatever we do. I've done both in scleroderma patients. Get the test negative. I've been able to do that with many scleroderma patients, many scleroderma patients. And then for your prevention, you stay on some form of a SIBO diet. I find it doesn't even need to be that restricted, plus your phenomenal prokinetics you're using for your scleroderma already. And then that works super great, super great. And, obviously the disease does progress. So I don't know how often the relapses will be, but we're able to, like with some of my cases, it was like once a year, whereas before it was all the time, so once we do that and you have the right pieces in place, as it progresses, it might be 3 times a year, but still that's pretty good. What a tough case is, a tough case is when you try multiple appropriate antimicrobial SIBO treatments to reduce the gas and they don't work. Like really, you've really tried. You've really tried. You've tried elemental diet. You've tried herbal antibiotics. You've tried multiple. You've tried antibiotics. Nothing's doing it. And obviously you don't go on with that forever, but you give it a good college try, and it doesn't work. Like meaning your gas is not coming down. That means something's blocking. Something is blocking. What is going on? Usually there's mold. There's MCAS. There's something else that has to be handled first. Not always, but
Guys, for the next 5 people, I'm just going to go wild here, who sign up for the course, I will give the mold masterclass that we did with Dr. Ami Kapadia. So if you have mold, you want to be one of the next 5 people to sign up, because that masterclass is a treasure trove. Do you want to mention Dr. Ami Kapadia?
Oh, she's wonderful. She's here in Ami Kapadia. She's here in Portland, where I practice, where I live. And she's our local mold expert here. She's an MD and a functional medicine doctor as well. She's in our community, and she's trained a lot of us in mold. And so I asked her to speak for Shivan's speaker series. And what I really like about how she discusses mold is she really tries to simplify it, because it can be really complicated. All the pieces. Sometimes SIBO seems like that. All the like do this before that and blah blah blah. She really simplifies it, and is amazing. Learning from her, I identified that I had mold in my house. And by the way, the mold in my house did not make me a tough case. So that was great. My SIBO, I've gotten it well under control. It did other things. It did other things for me, but I got that remediated and really saw a difference in my fatigue, actually. So
I remember it was a big deal.
Now, was I supposed to answer about weight loss or just the tough case?
No, go ahead and answer about the weight loss, because I know multiple people have.
Yeah, so a lot. This is a very common problem for SIBO. And last time I was saying the reasons why, in the last webinar, I'll just briefly mention some of the reasons for weight loss. The condition itself can cause it. Nausea can cause it. Diarrhea can cause it. Also, something I didn't mention last time is that SIBO is a condition of malabsorption. That is like the exact pathophysiology that is going on. Carbohydrate malabsorption is how come we have the gases. So there is malabsorption occurring in the condition. But then there's also the SIBO diets, which are low carbohydrate diets. But even more so, there's the fact that people need to restrict the diets even more than they're written to get the symptom relief they're looking for. So there's a lot of issues here. But even if a person was eating as well as they could, there's malabsorption and there's other issues. There's constant diarrhea. How are you supposed to keep weight on? So for many people. So what I recommend for just some brief ideas for weight gain is something you can do is have elemental diet shakes or some kind of caloric beverage. You can home make some lemonade as long as you don't have histamine issues. There's various things you can do to get to be drinking calories. Obviously the number one thing is try to eradicate the SIBO, but we're all already on that page. Another thing is to try to find carbohydrates that you can tolerate. If you don't know, many SIBO patients can actually tolerate starch, or at least one form of starch, and that would be white rice, white potato, or white bread, whether that's gluten-free or gluten-full. And so see if you can tolerate any of those. Now, some SIBO patients cannot tolerate any starch, but if you can tolerate starch, that's calories. It can help put on the weight. If you can tolerate lactose-free dairy, if you don't have a dairy allergy, that is an excellent way to do it. So like buying full fat yogurt and even lactose-free. You have to see what brands are near you. If you can even get lactose-free sour cream, just chow down. You gotta get the weight on, so there's more suggestions, but those are a few.
Okay. All right. So we had just 5 more people sign up. Thank you, Lori and company. And it's 5:46. I just want to make a note so those people will get the mold class. Okay. Next up, anybody here feel like they might have a parasite? Because we have a masterclass on parasites. So the next 5 people who want to come in for the course, I'm giving away the Dr. Ann Hill Parasite Masterclass. I'm writing it down, 5:46. And this, by the way, was unplanned and unrehearsed. But I'm just seeing your questions, and I see that you have SIBO and other stuff. And so I can tell. Which
is so common, SIBO and parasites, and SIBO and yeast overgrowth and mold issues are so common.
So what is it about, so how do you feel about stool tests? So we've got a lot of questions about stool tests.
Oh, I feel great about them. I always recommend them. And if you have digestive symptoms, I think some of the first things you should do, you should always get a blood test just to check for what the heck is going on. Just some screening, make sure there's no thyroid issues, diabetes, etc. A full screening blood test, but then get a breath test and a stool test, because then you've assessed the small intestine and the large intestine. I mean, there's more tests we can do, but that is really good to cover your bases. We want to know what's going on in both organs. And, stool test, meaning a functional stool test, that it's going to give you not just a microbiome stool test, but it's going to let you know all kinds of health markers for the large intestine.
Dr. Siebecker, we have a question that pulls, I think, a lot of the stuff you talked about together really nicely, which is, how do we know if we are a good candidate for doing the TrioSmart sort of hydrogen sulfide suspicious? What if you're like, I can do this one, which is just the 2 gases really easily, or when should I really try to go for it and get that TrioSmart so I can get the 3rd gas?
This is a very hard question for me that I don't have an answer for yet.
Okay.
Because from all the years that I have treated SIBO, my hydrogen sulfide, we used to identify hydrogen sulfide by a flat line test pattern, which I'm not going to take the time to explain. But whenever I would have that test pattern for years, I would write down the symptoms, and I was able to collect what those symptoms are. There's a set symptoms that go with hydrogen sulfide. So in the past, I would have said that. But what we've seen in this first year of testing for hydrogen sulfide is those symptoms are not correlating with positive hydrogen sulfide on the breath test. There seem to be, this is still early, so don't hold me to this. They seem to correlate to a flatline pattern, which means you do not have hydrogen positive, you do not have methane positive, you only have hydrogen sulfide. But what we've mostly been seeing with these TrioSmart tests that my group's been running is mixtures, is hydrogen sulfide plus another gas, and so the symptoms aren't correlating. And I wouldn't want to miss somebody that does, so that has hydrogen sulfide and another gas. So I mean, at this point, I think I would say to do the Trio Smart just because we don't want to miss that hydrogen sulfide gas. I mean, here's one thing I could say. Now, this doesn't quite apply to this person, but because that could also be like a sort of a tough case, is like you're trying treatments and they're not working, and you've had tests, and it could be because you don't know that you have hydrogen sulfide because you haven't had a Trio Smart, and so you never did a hydrogen sulfide treatment, and so you got no lowering of gas or not much help. But that doesn't help in this scenario because this person, for the first time, is choosing which test to do. So it's very hard choice. I don't have a good enough answer.
Okay. Let's see. Do we have any materials that can be presented to physicians? You've taken your book. Okay. Thank you, Julie, for getting the book. I appreciate that. To your internist. Thank you. And she refuses to prescribe anything indicated. She's usually open-minded. What's her problem? Then don't take my book. Take studies from PubMed. Sorry.
Studies are better then in that case. We put a lot of studies you can take to your doctor in the SIBO Recovery Roadmap course for that purpose.
Exactly. You have a healthcare system in your town that's a monopoly, and any protocol that is not on their radar is not allowed. Okay. Well,
oh, good Lord. I have experienced that, and but state by state, it can be crazy. There can be like clubs, and if they don't know you, they're not going to listen to you. It's crazy.
Yeah,
What advice I can give is internist is usually a primary care, but if you can find a primary care like family doctor, usually they tend to be used to taking the advice of specialists, and they're more open to hearing suggestions from outside of themselves. And if you can find someone who's really busy, then they're like, yeah. They're like, great. They want great. We'll just move it along here, So right. Look for that.
Okay. So we just hit another 5. So it's 5:51 now. Thank you very much. You will be getting the Dr. Ann Hill Parasite, the last 5 people masterclass.
She's phenomenal. Excellent. Of course, I didn't talk about her. She's phenomenal.
Phenomenal. Okay. Are you ready? We're in the last 9 minutes. Here I go. You ready, Dr. Siebecker? So anyone who signs up in the next 9 minutes is going to get the double whammy of the biofilm class and the, oh my gosh, what was the one that Alana did?
Alana did biofilm and Mona.
Biofilm. And Mona did bile. That's right. Dr. Mona Morstein did bile, and your stomach acid and your liver and gallstones and how that impacts SIBO. It was fascinating. And then Dr. Alana Gurvich did biofilms. Those 2 classes, if you have a long-term tough case and you don't think that anything's going to help, you want to get those classes, and you can buy them separately at SIBO SOS, and they're $77. Or I will throw it in right now. I think I just saw Rebecca come through. So you'll get both of those if you join us right now. I did. Rebecca, that's what you're getting. So there you go, on top of the course and class. So one more time, because I know, stay until the end, you're getting those handouts, guys, and the link, we'll send the recording. Here is here's the URL. That is my dining room where Dr. Siebecker, we went all over the country and did this over a long time. So you'll see different backgrounds and different hairstyles and stuff. But that is the URL. So please don't hesitate. This is my hope for you, is what Dr. Siebecker also hopes, is that you take your power and you really take that next step of action to get well and to be educated. So you take that education, put it into thinking. Wanted to show you one more time. Did I just pop in the SIBO course, Dr. Siebecker? Is that what you see?
Yep.
Okay, great. So you've got, this is inside the course. SIBO types, updated. See that? Remember, you're getting the updates too. First, the second line and third line therapies. If you don't know what that is, you got to find out. Underlying causes. This is 47 minutes of pure, what we call gold in the course. And then acute versus the 3 other types, and on and on. Everything's transcribed. You do have the ability to, search those transcriptions. And this is that interactive chart where you click on one of the blue links and it takes you to that lesson. So you can go top to bottom and be very methodical. A lot of people do that, but other people identify themselves where they are on the algorithm and then just click that link. You want to do some of the contextual stuff, especially if you're just getting started. So Amber, I'm talking to you. Okay, let's see here. Do you need a break between treatments, or do you continue immediately if needed?
I like a break. A break is realistic and practical, for most practices, because while we know that we can kind of predict the amount of courses we think are going to happen, sometimes it's better than what our prediction is. So I think it's a good idea to do one round and then assess, right? So then do a retest, see how the person's feeling, right? If they're not fully better, then you do a retest and see what it shows. And if there's any way to make that period be about 2 weeks, that's great. Not too much longer. That can be hard, but if possible, and then you start the next one. I also like a break because I just find it helps refresh the effect of the treatments. We call that a drug holiday, but it applies for herbal antibiotics as well. And we just want to let and see how things are. Now that I've said all that, you don't have to. If you already know there's super high gas and the person now isn't really feeling very well, you can just immediately go on to another round. So you can do it both ways, and it kind of depends on the case and the circumstance and what's happening.
Okay, Eileen is asking a question. What about biofilm disruptors? I used one, biocidin. Do you consider that a biofilm disruptor?
Well, I don't, but Dr. Paul Anderson does. He says it has a little bit of, he has these phases of levels and phases and potencies of antibiofilms, and he puts that one sort of down there with like silver or maybe a little higher than silver. But anyway, keep going with her question.
Okay, well, she had her SIBO numbers went up from one test to another. Can the biofilms uncover more bacteria?
Oh, yes. Oh, yes, they absolutely
Eileen, you need to get this course so you can get that biofilm masterclass. Sorry. Yes, it does, right?
Yes, absolutely. It can do that. And then, when they go up, we just want to keep treating. We have to treat that, continue with treatment, do another round of treatment, and you'll eventually see it come down.
Okay.
And one general thing on antibiofilm is that we had not seen that it makes a difference. This is just my very brief thing on this. But we were using standard antibiofilm, which are enzymes that you take between meals. And Dr. Paul Anderson said, try the bismuth forms of the antibiofilms. And I only got the chance to do that briefly with patients before I stopped practicing, took a break, and it was good. So I think it really matters the antibiofilm you're going to use.
Okay. It does. That course, we have one more available for whoever's next is going to get the combination Big Mama JAMA for the
Antibiofilm and bile.
Thank you. Clarissa's text is messaging me. Clarissa, it is 5:57 East Coast time. Go ahead and put the links that everyone's been waiting for to get the handouts, to get the chocolate cake or cake recipe, Dr. Siebecker's cake recipe. She's so nice. She actually called one of my friends and had them, thank you very much. Okay, Renee just got that. Okay. But she called one of my friends and had them make that cake recipe for me and surprised me at my birthday. It was very, very sweet. Very sweet. Okay. Last but not least, in our last few moments, we have something called the behind the scenes called the Ultimate IBS and SIBO Rescue Summit. What I did is I went through the SIBO SOS Summit 1, 2, the IBS and SIBO SOS Summit, the Microbiome Rescue Summit, and the, I don't know, I've done 9 summits now. So I went through all of those and I put them together in one summit. I took sort of like picked and choose the most useful. They weren't like they were better than others, but I did it to make almost a curriculum. So that is called behind the scenes, the Ultimate IBS and SIBO Rescue Summit. And we just have a few moments here. I know Dr. Siebecker is going to be leaving, but if anybody who signs up right now, you're going to get that too. I will throw it into the mix. Remember, you're getting the 8 Q&As, you're getting the PDF of the book because we're here right now and I haven't turned off the recording yet. And you are getting that brainstorming session with me for, you know, like what to do next. I'm not a doctor, but I certainly do know a lot of information and can certainly help hug and support you and cheer you on. Okay. So I'm going to close up the questions. I thank you very, very much. You're excellent, excellent questions. That's very motivational. I got to tell you and I did try to get to as many as possible. Please, they're all over, actually got through or cleared 75 questions. Please do consider that alone, the value of the Q&As is huge. It's really, really huge. So thank you very much. Clarissa, did you pop it into the link? Say there, hi, we have your tech guys' names. Yeah, we will be collecting the winners' names manually. So
We saw that people were saying there's trouble with the links to the handout.
Oh, let's see. I'm going to go there right now and see.
Oh, Clarissa's giving a response.
Okay, great. So today is part 2, right? So looking forward to having, so Clarissa, do you have the right link? Because it looks like it says, looking forward to seeing you for part 2. And that is today. This is the part 2. She's messaging me. Handout link is dead. Okay, boo. We have your email address. So don't worry. We have your email address. Take a breath. You have no idea how picky I am about the customer service. I call it concierge customer service. I mean, I truly come from, I want to treat you all the way I would like to be treated. So please, please, please know that if you are having an issue, email us at info@sibosos.com. Give us a little bit because we're going to send out the recording tonight and we'll send the link for the handouts. Don't worry. And that's only for people who attended. So yeah, it's a big deal that you were here. You're also getting that PDF for the book if you buy right now, and it's 6:01. So I want to honor that and say thank you very much. Please, please, please pop into the chat some love for Dr. Siebecker. Thank you all. Please join us if you can, if you're inspired to in the course. Dr. Siebecker, thank you so much.
It was such a pleasure, everyone. Thank you for your excellent questions.
Thank you. All right. Take care, Dr. Siebecker. I'll talk to you soon. Bye-bye. Thank you. Thank you all so much. Don't worry, you'll get the handouts. You'll get the recording. Martha, I'm a big fan of visceral manipulation because one of the underlying causes could be adhesions. So that is huge. That is really, really big for you to look at. I'm so glad you all were here. The next training, here's why we did 3, because we couldn't fit it all into one. So I'm going to wrap up the recording, but I'm going to stay here for another minute. Thanks you all. We'll see you soon. SIBOSOS.com, and we'd love to see you there. And the Facebook group, SIBO SOS community in Facebook with 22,000 of you going strong.